Good day, students. You are welcome to yet another exciting topic, which will discuss nutritional requirements. Use is study session 4 of NSC 307. Please sit down and enjoy this lecture. In the last two study sessions, you have learned about food, diet, nutrients, and as well as food classifications. In this study session, you will learn about the nutritional needs at different stages of women's cycle, to include during the infant, the adulthood, the old age, during pregnancy and then lactation periods. What infants and children require is different from what an adult and the elderly will need. Also, there may be specific nutrients in which a pregnant or women or lactating mothers needs in higher amounts than adult men. So as a nurse, in this study session, we give you the appropriate message to pass across to different population groups as concerned with their nutrition. At the end of the study session, you'll be able to explain the importance of having knowledge of nutritional requirements. You'll be able to describe the food needs of pregnant and breastfeeding mothers. You'll be able to describe the nutrient requirements during infancy, childhood, and adolescence. And you'll be able to describe the nutritional requirements of adults and elderly people. There are different reasons why we study nutritional requirements. One, it could be for prescriptive reasons and it could be for diagnostic reasons. In prescriptive reasons, it will help us to provide or dispense food supplies. For example, to procure food for national consumption, to secure food for institutional consumption, to run nutritional supplementation programs. And if it is diagnostic reasons, it will be to identify whether a group or an individual is suffering from malnutrition of any kind. For example, to evaluate the nutritional intervention programs, to determine whether the food available in the stock is adequate to feed the household or nation for a certain duration of time. And in order to estimate nutritional requirements of individuals or group, we need to consider some factors like the physical activity, the age and sex of the individual, the body size of the individual, the climate, and the physiological state. And based on these factors, nutritional requirements in different segments of the population can be classified into four. We have the pregnancy and the lactation phase, the infancy and the childhood phase, the adolescent and adulthood, and the old age. Now we'll look at each of these in turn. Looking at the nutritional needs during pregnancy and lactation, an unborn child needs a healthy and well-nourished mother to grow properly. Therefore, a mother needs to gain weight during pregnancy to help nourish her growing baby. This study is examined under 6 subdivisions: gaining weight in pregnancy, eating during pregnancy, preventing anemia in pregnancy, pregnant women with special needs, health workers' role for pregnant women who need special help, and nutrition during lactation. Increased requirements. There is in pregnancy, there's increased requirements like energy, protein, essential fatty acid, vitamin A, vitamin C, B, and calcium, phosphorus, iron, zinc, copper, and iodine. Women should at least gain 11 kg during pregnancy, and if the mother gains less than this, the baby's chance of survival is low, and such a baby is susceptible to health declines. And if the mother is overweight, she still needs to gain for her baby's health. She should not try to lose weight while she's pregnant. Gaining weight in pregnancy should be smooth and steady. If the weight gain occurs suddenly, she should see a health professional. During the first 3 months of gestation, she should expect a gain of a total of 1 to 2 kg. And during the last 6 months, she needs to gain about 0.5 kg each week. If she has already gained about 11 kg after 6 to 7 months, she should continue to gain moderately until delivery. The baby puts most of his weight during the last few months. The baby will gain most of his weight during the last few months. And eating during pregnancy, women's nutrition during pregnancy and lactation should focus on the 3 micronutrients and extra energy intake or reduction of energy expenditure. Therefore, the following are essential nutrition actions related to maternal nutrition. A pregnant or breastfeeding woman needs extra food, especially those that are good sources of iron. Pregnant women need at least 1 additional meal, about 200 kilocalories per day during the pregnancy. A pregnant woman needs to cut down her energy expenditure. She should reduce her involvement in strenuous household tasks that leads to higher energy expenditure. Pregnant women should eat iodized salt in their diet. Pregnant women should take vitamin A rich foods like papaya, mango, tomato, carrot, and green leafy vegetable and animal foods too. In the malarious areas, pregnant women should sleep under an insecticide-treated bed net. Pregnant women during the third trimester of pregnancy should be dewormed using mebendazole or albendazole. Pregnant women need a well-balanced diet containing mixture of food, and this should include, as far as possible, food from different groups. Remember, there's no need for high-priced foods. A pregnant or lactating mother can get extra foods by eating a little more of ordinary meals. She should increase the amount of nourishment at 1 or 2 meals, not every meal. In pregnancy also, we need to prevent anemia. Some women feel weak and tired when they are pregnant. They may be anemic, which in turn means that they may have difficulty in pregnancy and childbirth. Common problems linked to the mother's anemias include babies will be born without 3 to 6 months iron supply. Breast milk may be insufficient. A pregnant or breastfeeding mother should have enough iron to keep herself and her baby healthy. She should eat plenty of iron-rich foods, green leafy vegetable. A pregnant woman should go for her first antenatal visit at latest by the 4th month of her pregnancy. At the clinic, they check her urine for excess sugar and proteins and her blood for malaria, and you diagnose anemia at any of this stage using maybe the examination of the lower eyelids, the examination of the inside of the lips and the palms, which should be bright pink. And if there is anemia, all of this will be pale and whitish. Also, iron supplements can be given to pregnant women. Pregnant women with special needs. Some pregnant women in the community will be particularly vulnerable. And as healthcare practitioner, it is important that you identify the women who need extra help and support. Also, as health worker, your role includes to visit the pregnant women often. You need to encourage them to eat a balanced diet, like we have discussed in the previous study session. You need to let them be the first ones to receive iron or food supplements when available, and you need to help them get proper health care. You need to encourage other members of the household to do the same, or to do some of the work and lessen the burden on the woman. Let's look at the nutritional requirements in infancy and childhood and adolescence. The common feature of infancy, childhood, and adolescence is that all these groups are undergoing rapid growth and development, and this in turn possess a heavy demand on their nutritional requirements. In this study is explained under 2 subdivisions: the adolescent growth spurt and increased need for nutrients. Adolescents also undergo a very rapid growth during their puberty, which is called the pubertal growth spurt. And during this phase, they increase rapidly both in weight and in height. Therefore, they need a nutrient intake that is proportional with their rate of growth. The growth rate is at the very high right after birth at the infancy stage. Then the growth rates will slow down until the age of 12 to 14 years. At about 15 to 16 years, which is the puberty stage, there's a sharp rise in the growth rate of velocity. After that, the growth rate slows down again. Their requirements for macronutrients and micronutrients are higher on a per kilogram basis during infancy and childhood than at any other developmental stage. These needs are influenced by the rapid cell division occurring during growth, which requires protein, energy, and fat. There's increased need for nutrients for energy. While most adults require about 25 to 30 calories per kg, a 4 kg infant requires more than 100 kilocalories per kg. Infants of 4 to 6 months who weigh 6 kg require roughly 82 kilocalories per kg. As an energy source, breast milk offers significant advantages over manufactured formula milk. Breastfeeding is associated with reduced risks of obesity, with a wide range of allergies, hypertension, and type 1 diabetes. Higher intakes of protein and energy for growth are recommended for adolescents. For most micronutrients, recommendations are the same as adults in adolescents. Exceptions are made for certain minerals needed for bone growth, like calcium and phosphorus. and evidence is clear that bone calcium accretion increases as a result of exercise rather than from increase in calcium intake. Looking at water requirements in children, children have a larger body surface per unit of body weight and a reduced capacity for sweating when compared with adults, and are therefore at greater risk of morbidity and mortality from dehydration. Parents may underestimate this fluid needs, especially if infants and children are experiencing fever, diarrhea, or exposure to very cold or hot temperatures. Then some fatty acids too are essential, which play a key role in central nervous system. However, infants and children should not ingest large amounts of food that contain predominantly fat. So it is important to get the balance right. Let's look at the nutritional requirements during old age. The nutritional needs in an adult of 19 to 50 years of age differ slightly according to gender. Males require more of vitamin C, K, B1, B2, and B3, and zinc, and females require more iron compared with males of similar age. You have already seen that pregnant women and lactating mothers have particular nutrient requirements that are necessary for their own health, as well as the health of their baby. However, elderly people are especially vulnerable to nutritional problems due to age-related changes in their body. There are some problems associated with nutrition in old age. We can have problems of procuring and preparing food. They can have psychosocial problems. They can have digestion problems. They can have nutrient absorption problems. They can have renal changes. They can have memory loss, that is senile dementia, which may include forgetting to eat. They can have sensory changes. They can have physical problems like weakness, gouty, arthritis, and painful joints. Specifically, an elderly person requires less energy than a younger individual due to reduction in muscle mass and physical activity. Some daily requirements for elderly people differ from those of younger adults. For example, in order to reduce the risk of age-related bone loss and fracture, the requirement for vitamin D is increased from 200 IU per day to 400 in individuals of 51 to 70 years of age, and to 600 IU per day for those over 70 years of age. Suggested iron intake reduces, however, from 80 mg per day in women aged 19 to 50 to 8 mg per day after age 50 due to better iron conservation and decreased losses in postmenopausal women compared with younger women that are still menstruating. Also, some elderly people demonstrate selenium deficiency, which is an important mineral for immune function, and impaired immune function affects susceptibility to infections and malignancies. Nutritional intervention should first emphasize healthy foods with supplements playing a secondary role, although modest supplementary doses of micronutrients can both prevent deficiency and support immune functions. Very high dose supplementation may have the opposite effect and result in immune suppression. Therefore, elderly people also need special attention with regards to nutritional care. Thank you for listening. See you in the next study session. Bye for now.